take just a minute to walk you through the steps and then show you what it looks like when our muscles are contracting when we have the electrodes in the suprahyoid position. So I'm going to go just kind of step by step. We're going to take a couple of minutes. This will just be the first time you see the full process of prepping the skin and placing the electrodes. And then I really want you to get a good idea of what those muscles look like when they're in that full contraction or when we've reached that motor phase. So when you open up your electrodes, when you get a chance to take a look at these, you're going to notice that all of the electrodes that come in your lab kit look the same. With your Aspire 2 device, you have two different types, and right now we're just using our 1-inch round electrodes. You'll be able to identify what type they are by that writing on the back between the barcodes. So when I open this up, I'm going to find my 1-inch round electrodes. We'll be talking about all the different sizes at another point in class. You'll also find your skin prep pads. Now these are one use or one patient, I should say, specific. They're patient specific. You want to write the patient's name on the container. I'm shaking this down just like I would a spice packet, because it's full of liquid, okay? And you want to make sure you don't open that over something valuable like your laptop or your patient's antique dining room table. And you don't want to get too crazy with the skin prep. We're just trying to remove any natural oils from the skin, lotions, makeup, anything that would make the electrodes not stick. You're also creating just a little layer of skin prep that is sticky. So my fingers are going to be just a little bit sticky. That will be a little sticky under my neck. You want to make sure you throw that packet directly in the trash can. And we want that to dry all the way before we place our electrodes. While those are drying, I'm going to take a look at my electrodes. So they come sealed in that package on the clear plastic. The clear plastic is nice because we can use it to kind of eyeball and look at that spacing. The back has a blue X. That's just plastic to help hold things in place. Okay, so you'll need one set of electrodes at a time. And we always want to make sure that we don't touch the back of the electrode. That gel, we want that to be pristine. We don't want oil from our fingers, or if you have gloves on, that would stick to that gel. So I remove them from the plastic and I hold this just like a lollipop. So don't be afraid. Our electrodes are actually really well made. Okay, so you can pick it up by the lead wire. And notice I'm placing them closer together. And just kind of to give you a point of reference, it's about the width of the end of that lead wire. And if I were the patient, you could actually hold this up under my chin and kind of get a good idea for if that spacing is going to be appropriate or not. Okay, we're spacing based on the submental triangle. And we can size up and size down our electrodes based on that. Okay, we don't want our electrodes to overlap, and we don't want them to be out over the jawbone. When we're locating our suprahyoids, if you'll recall, we talked about we're going to start on that jawbone. Okay, so we're on the chin, on the bone, and then it's one step, two step. So it's soft and squishy. And as I feel right here, when I swallow, I can feel a contraction of my suprahyoid muscles. So that was jaw, 1, 2. Nice neutral neck. A lot of your patients will try to do this. Okay, so we want to make sure that we're keeping a nice neutral neck. You may need to have them swallow, either on cue, which would be the easiest, or you might have to give them a drink while we palpate. Or we might give them a bite of something, or some sour sugar, or a cold sour bolus, whatever is going to stimulate or help initiate that swallow. That's perfectly fine. Now, I've also got some paper tape, and we include that when we send out our lab kits, not to help you hold the electrodes on, but actually to help position them. So let me show you what I mean here. I've got a piece of electrode or piece of tape right over the top of the electrodes. I'm going to put another piece right over the bottom. It doesn't have to be a perfect rectangle or anything fancy. I'm going to make sure those are stuck together. That's stuck on the paper. And then I can actually remove the electrodes as one piece by pulling on the tape and the lead wires. Okay, so now I've got two electrodes side by side. I can come and feel for that jawbone. 1, 2. Now, sometimes when we're doing this on ourselves, it's a little easier to look in the mirror. Smooth that tape out, one finger over each electrode. And I can feel that contraction right under. Okay. Now, the next step is to use some self-adhering bandage. One of the brand names is Coban with a C. You could also use a knit headband. Okay. The reason I use this is because it sticks to itself. So let me show you. I'm just going to get a piece long enough to go up and around my head. I'm going to center that. Okay. Now it's not too tight, but it's pulling everything up nice and flat. This will make a big difference whether you're doing surface EMG or NMES. We want to make sure, if you think about particularly our older patients, we want to make sure that we've got that pulled up nice and tight. If we have a lot of sag, we're not going to get a good transmission of that signal. Okay. Now, as I go ahead and hook things up, on my device, I'm going to connect my two yellow lead wires. There we go. Nice and tight. I'll turn my Aspire 2 device on the top. When it comes on, it defaults to NMES. I'm going to hit my mode button. It defaults, to surface EMG. I hit my mode button and I went to NMES. Now I can see my program. And right now this device is on the A4 program. So I'm going to use my triangle. And when I do that, it takes me to the different programs. So right now I'm on A1. That's my standard program for the submental placement. And I hit play. Okay. And I hit minus, minus, and plus, and that's a safety feature. That's just going to gradually, I'm going to gradually increase it, but that minus, minus is a lock. It's a safety lock. Okay. So right now I'm still going up. Let me get this turned up high enough that you'll be able to see that contraction. Okay, so I want you to look right here. I'm in rest. Here we go. 5, 4, 3, 2, 1. Now, if we think about also palpating, I could have my pointer finger and my middle finger right here with my other two trailing. 2, 1. Okay, so it was gradual up for 2, tight for 2, relax. Okay, and that gradual up is my ramp up time. Show you one more time. 2, 1. You see slight involvement of my mentalis muscle because it is so tiny, right close to the surface. And it's not painful. I don't feel it myself. I can just see it. And again, I'm getting that good contraction and movement. So now we would start timing a swallow with our stim. So maybe it takes me a little extra time. Okay. I swallowed just a little bit early on that one. I'll give you one more for an example here. But you're going to cue that patient or provide that stimulus or bolus so that they're swallowing during the work cycle. So I hope that helps you with a little bit of a visual. It's not the only one we'll get during our course, but just kind of wanted to introduce you to the process of placing the electrodes and what that looks like, as well as what it looks like when we get to that motor phase and we see those muscles move.